Porcelain veneers, what's your process?
The process for porcelain veneers is firstly meeting the patient, understanding their aesthetic concerns, because it's always important to listen to the patient first. And from that process, we embark on the whole smile design workflow to design the ideal design for the patient, to be able to mock that up with our initial smile design and mock-up, or trial smile as you'll call it. And once we've verified and everybody's happy that this design is ideal, and there's sometimes often changes, modifications. And from there you've got the template, you've got the blueprint for what's the ideal shape and design for the patient. Then the manufacturing process starts. We prepare the teeth conservatively based on where the ideal will finish. So we've got technology that prevents us from hacking the teeth. Often people, the first thing they ask is, oh my God, are you going to shave my teeth down to stumps? But knowing what the final design is allows us to be very conservative, which is a really big point that when you do come see us, we're very conservative. It's a double-edged sword, because the more conservative you are when you prepare those veneers, the longer it takes to cement them. I'd rather take my time cementing them, knowing that I've still left enough tooth structure for someone that, again, is going to have those veneers for 10, 15 years.
So what's the follow-up process for veneers?
The follow-up process for veneers is like the follow-up process for natural teeth. Regular hygiene checks, maintaining excellent hygiene practices at home. We certainly pay a bit more attention to, because it is a ceramic, so we're a bit more diligent on wearing a night guard. In particularly all cases that have any ceramic work, we do encourage some sort of protective guard at night. It's called a splint. In some cases, we also use Botox in the jaw to try and sort of alleviate any of that. So it's really checking the fit, maintaining that there's integrity in the ceramic. Sometimes you might find things, and if you're checking them regularly, you can easily fix that, and it's before it becomes catastrophic or it gets out of hand. But it's a regular check, just like any healthy dentition.
How long can you expect veneers to last?
We like to say 10 years, but we've had cases last 20, 25. And there's many factors. How well, firstly, there's the hygiene side, but also it's how careful patients are. At the end of the day, it is jewelry. It's jewelry on the teeth. They have to be wary. Just like natural teeth, if you start opening bottles with your front teeth and so forth, you're going to chip your own natural enamel. It does depend how you take care of your teeth. There's many factors, but we like to say 10 years plus for a set of veneers.
Is there a difference in the type of porcelain veneers that you do for different people?
Oh yes, 100%. There's certainly a difference in case selection and material selection. We use glass ceramics. It's called feldspathic, but it's a clear natural glass ceramic, which are beautiful, very natural veneers. We're using a lot more zirconia type veneers now. But again, it depends what you're trying to hide. If you've got multicolored teeth, you've got broken down teeth, that would require different material selection. Whereas if you're purely changing the shape of teeth, but the color underneath is consistent, then you can use a slightly even more natural material. But again, it's understanding what you're trying to achieve, and at the same time using the right material so all of them maintain an even color and even base and look natural, and you're able to achieve the desired outcome.
When you do veneers, does it affect the way a person smiles? Does it affect their speech or anything like that?
Yeah, it certainly affects it. It enhances it. I mean, that's what veneers are for. You're enhancing your smile. Speech is certainly not affected if all the right parameters are followed and all the design process and all the testing. You're in temporaries, provisionals for 2-3 weeks, sometimes longer. Sometimes we make a set of long-term provisionals in really complicated cases that involve gum manipulation. If there's receding gums, we're also treating. When it's done correctly, all you're doing is enhancing. We certainly don't try and aim to make anything worse.
Does it change your bite?
If you're wanting to change the bite, or if there's a need. If your bite's collapsed and we want to build up the bite, of course. If your bite is fine and the heights are adequate, then we will work around the design where it doesn't affect the bite. I'm Fadi Yassmin, and I look forward to welcoming you to FY Smile.